A very good afternoon to all of you. I can see that now we have around 40 participants who have logged in from different parts of the world, including India. And thank you very much for joining for the second webinar in the series on shit flow diagrams, a tool for advocacy for improved urban sanitation programming. My name is Suresh Kumar Rohila. I am the Senior Director at Center for Science and Environment. And this webinar series is organized as a part of series of activities from the School of Water and Waste, which is the training and capacity building hub. So this initiative is part of creating awareness as a part of SFD promotion initiative. We are trying to connect today from America, Columbia University, Zach, from UK, Manoj Roy, who is talking to us about his experience of using SFDs in, Dar es Salaam and Dhaka. We have Unnati from South Africa. We have also Mueed from Bangladesh. So we have interesting presentations lined up for you people. So welcome all, and I'm sure you are looking forward to listening to them. So I have with me also, I should tell you, my two colleagues, Bitush and Amrita, who have been working hard to put this webinar together. And I would like to say that, we started this journey of using SFD for urban sanitation programming in India almost 2.5–3 years ago. CSE had published a 600-page book on excreta matters. This was a book with, a lot of photographs, data, facts, and figures, and we were trying to push for change, that how Government of India should bring in reforms in water and sanitation sector. That's when a group of sanitation sector player approached us that, there was a tool which was developed by World Bank, and they had used it successfully to push for reforms in the area of, improved urban sanitation programming. So you can see on the screen, there was this 2-volume book on excreta matter, and we were still using the photograph of a WC, a toilet, which we were used to tell that, there is something seriously wrong with this mindless technology of flush and forget. We were also talking about that people were not aware that where does their shit flow or where does the wastewater or the fecal sludge go. There were some black boxes in the form of septic tanks or pits, but nobody was aware of what the hell it was happening with in terms of sewage and surface management. So we partnered with this group of stakeholders, and we developed 11 cities in India of the 50 cities where we were supposed to do shit flow diagrams. These 11 cities in India, which were chosen, were from different parts of the country across India, from different agroclimatic region. And these 11 cities were, as you can see now on the screen, different size cities and different agroclimatic regions. By this we were able to, at the national level, raise the awareness that things are not all right in different cities. And big city solutions may not be able to, may not succeed in small cities, and small and medium cities, which are totally on on-site sanitation systems, would require a citywide sanitation approach. So this was one of the major, kick-starting of our advocacy on urban sanitation programming. Then we pushed our agenda to the next level, where we saw that in River Ganga Basin, which is the largest, most populous region, and it accommodates 40% of India's population, and there is a big river pollution problem. And all the fecal sludge and untreated sewage is dumped into either neighborhoods or into the river. So if you can see, there were around 10 cities chosen, which we were supposed to be pushing for a change and reform in the way the urban sanitation programs are running in these cities. So if you see, as compared to the previous cities which we had chosen, in Ganga Basin, which is one of the most polluted region, if you can just go back, Amrita, in the slide in India, and if you see now in the Ganga Basin, back again, you would see that Ganga Basin offered a very good case for making, pitch for improved urban sanitation programming using SFDs. Next. And that was also the beginning of our journey for where we were invited by the state government in UP, Uttar Pradesh, which is the largest state, where there has been a lot of investment in 33 sewage treatment plants being set up across the state, and National Mission Clean Ganga, which has 97 cities, priority towns. However, things do not seem to be going right. And, we were included in the agenda and the reform for how the states and the national mission of River Ganga cleaning could bring some instrumental changes on how the things are being handled. So I think these were some experiences in India which made us also realize that we should put together this seminar and a webinar whereby we could invite various other people who have used this tool successfully or intend to use this successfully as they advocate for bringing change and reform in urban sanitation sector. So I would one by one invite a few people for the talk, but I have with me Bitush, who has been leading this exercise of preparing SFD. Bitush, would you like to add something here?
Not much. But then the objective of the webinar is to look at what SFDs can do for us. If you look at the slide showing on the screen right now, several possible ways which we know are listed, be it initiating planning or pitching for sanitation infrastructure or gaining political support. So these are some of the ways which we know, but I'm sure that people have tried out SFDs for many more applications. And the purpose of the webinar is to actually know and understand and learn from experiences from different parts of the world. So, I'll not waste much time.
So we will invite the first speaker, and we have today our first speaker with us, Dr. Abdul Mueed from Bangladesh WaterAid, and he will tell us about the application of SFDs in Bangladesh. With 10-12 minutes, and then we can open up for question answers.
Okay, just to confirm that everyone is hearing, right?
Yes, everybody can hear you. We can see the screen as well.
And we have 37 participants.
Okay, thank you everyone for arranging this webinar, and thanks to all who already joined to listen to the stories. So, as like Suresh, my long friend, and yeah, Ben already mentioned that it matters, excreta matters. So at the last minute, I changed my presentation to SFD matters. And how is that, influencing and impacting to our program? That's the journey, and I would like to mention that journey to all of you. So welcome to everyone. And first of all, I would like to highlight on what FSM initiative, the citywide sanitation initiative that WaterAid Bangladesh has taken few years back. A bit of glimpses I would like to mention here to understand how SFD impacted throughout our journey. So this is the first initiative by WaterAid Bangladesh, possibly by anyone in Bangladesh who wanted to capture all the sanitation value chains all together, and starting from containment to collection to treatment to finally reuse. So it was a very dream project at the beginning, and once we had the dream, and we needed to have some discussion with the municipality, starting from containment. What containment availability is there? Just to mention that it is a small municipality, Shokipur municipality, which has a 35 to 40,000 population, and more than 5,000 are pit toilets, and more than 500 are septic tanks there. So, in order to capture that scenario, what sort of transportation and treatment systems would be required there? Of course, as we work with the municipality had all the decision-making power. So in order to do that, we needed to have some very fruitful discussion among all of them. And we decided that that could service at the beginning, with which capacity is 1,000 liter, would be fair enough. And through this, we can capture 50% of the, more than 50% of the accessible areas of the municipality, which is ready-made at this moment, and we could start our journey of emptying right at this moment. And after that, we have some treatment and reuse finally as a co-compost product. Very this is the crisp of the whole sanitation value chain capture. But today's presentation is not that story. Today's presentation is how it has impacted to this journey. And in order to state that, I would like to start from the planning phase. So in this presentation, you will find some red, green, and amber stamped, just a circular stamped throughout this presentation. Just to save time, I am just giving a bit of explanation. What does it mean? Red means very difficult, almost impossible, or blockages, strong blockages. Green means we achieved that. Amber means difficulties, but we need to push ourselves a bit more to reach the green. So here at the beginning, 2015 journey started, and at the time we prepared this SFD, and right at the corner, topmost corner, you see the SFD there of Shokipur municipality, which mentioned that 21% of fecal sludge has been safely managed because of the containment. It's not nothing we did there. No one did anything there. But the important point is the rest of the waste goes to the environment and pollutes severely. So that SFD actually helped us during what the initiative we took at the time at the planning phase, very initially, as an icebreaker. When we break the ice, that's the important part. Otherwise, we cannot go into the deeper options. Later on, while the discussion went on and on and on, and this is an advocacy tool, it helped us also to identify the hotspots where we need to put our interventions, the right decisions by the municipality. In order to do that, as I mentioned, the toilet types of this municipality and accessible route, and those are the ingredients to identify the proper action plan for emptying. 1,000 liter vacuum tank, is it fair enough to capture the scenario? Do you need some gulper or sludge pump? Whether this vacuum tank can access even even at the narrowest route or not. I mean, those type of strategic discussions, which we call the system optimization, needed to do by ourselves, and throughout the discussions, all sort of things. So that actually helped us to initiate the local and national level capacity development initiative. And I would like to thank CSE also that we did it for the so long that national level capacity, sector capacity development FSM initiative was also a part of that. It also opened the door for the who are the identified stakeholders for these FSM initiatives, and this is a very important part. So do we go for some agriculture, environment, health, energy? Does Shokipur needed some biogas for the whole municipality? Whether industry does need that, health sector, whether we how to integrate that, or the agricultural product, the demand has high or not. I mean, this sort of thing is important to have the final decision of the reuse. And when we had this identified stakeholders during our journey, and we found that the Shokipur municipalities are appropriate one for reusable product of co-compost, and that's how we selected our treatment technology, co-composting. After discussing the matter with the Shokipur municipality right at the beginning of the planning phase. When we see that the implementation phase, we implemented that part, and throughout our journey, if you go to the previous one, it is green 21%. After 2 years of operation, it becomes 58% of green through the co-composting initiative. And actually, throughout this method, the municipality took all the initiatives to show their own responsibility, and from where we could identify that how much money would be required for sustainable FSM service, good quality FSM product, co-compost, agricultural linkage, and that is the point where we can put teach right at the pinpoint for financing throughout, where to finance, resource mobilization throughout the local government, throughout the national government, throughout the donors, how to engage them. That is very important for the sustainable operation. So those sort of things actually given drives, and still this is an amber product. Of course, it will be amber for the next few years, definitely. And we need to push our advocacy initiative for budget allocation to show more responsible municipalities throughout the country, not only Shakipur. The other part is when we started during that time under the Local Government Act 2019, an institutional regulatory framework was developed, and all the regulatory framework what is mentioned, thus more responsible municipality which has the mandate to provide sustainable FSM operation, and exactly that is the policy integration. And after 2 years of operation, we can say that, yeah, the municipality has been strengthened to show their commitment in terms of the regulatory framework. I cannot resist myself to, express one thing, that the political will is one important factor here. Position is also important here. The mayor of that municipality, you all know that. I mean, the national election is coming after a few months, couple of months here in Bangladesh, and now the mayor is trying to become the candidate for the member of the parliament. It also indicates that the position of the mayor has been enhanced throughout this initiative of FSM. And every time mayor had the discussion with all higher authority, he showed two pictures. One is the 2015, other one is the 2018. That's an important story, real integration and real impact at the political, will. Other part is definitely the environmental monitoring. We all are striving for the safely managed sanitation, and if it continues like that, this Shakipur municipality has a vision and dream to declare itself that it will reach safely managed sanitation by 2021. It will be. I promise that it will be the first declared municipality in Bangladesh which will achieve the safely managed sanitation status in across all the municipalities of Bangladesh. It has also pushed us the context-specific innovation, the made in Shakipur, made for Shakipur. That the municipality when took all the decisions to have this system which is made in here with the knowledge, technology, everything. The operation and maintenance will be their part, and it is easier to do them, and it also enhances their ownership and responsibility, and we are proud of that. This is for Bangladesh and made in Shakipur and made for Shakipur. A model to replicate what WaterAid and other development organization is always striving for, because sustainability is an issue. Once we have this picture, that 2015 to 2018, we get this picture throughout this FSM journey, we have got an advocacy model for replication it in other cities. And as an impact of that, we started in 2015 in Shakipur, the bottom SFD, and the topmost one is in the Sayudpur municipality, what we very recently started, and we will follow exactly the citywide FSM initiative, and SFD is definitely an important part of that. And still, I put it as an amber because it is an initiative just have been taken, and the construction is going on. Hopefully, it will give us a very good example in the coming future. I cannot resist myself also that how it has influenced others to make champions, not only by WaterAid but also others, because we cannot work everywhere. So in order to do that, we need to bring up the championship by other organizations, other institutions, even the local government also. In order to do that, we also developed some sheet flow diagram of Noshingdi municipality, Netrokona City Corporation. The green one, why is it Noshingdi municipality? Because already the municipality has taken the initiative to strengthen their FSM plan to make it an active one, operationalized one. That's why it is green one, already green. You see how it has influence. Netrokona is still red stamped, Sylhet is still red stamped, Sirajganj practical action is taking the initiative there, that's why it is in amber. Rajshahi still red one, Gazipur, not only by the municipality but other sector actors are taking initiative on FSM here in this city corporation. Just to mention that Gazipur City Corporation is the largest city corporation in Bangladesh, so it is a very big one. So it has to be taken by integrated way. We after ensuring that all stakeholders are involved there before taking a very big decision. Mymensingh City Corporation, our another NGO, already has taken place there. That's why it is green. By NGO Forum has taken initiative. Kumilla is still amber. We hope to enter there, and another one is the Narangan City Corporation. It is also a biggest one. That's why it has to be integrated one. But the point is here, we do this advocacy to make some national champions, right? And both local level and national level, and these has the influencing power tools to make it like amber to light green to greenish to greener to finally the ultimate target green. FSM story has just begun, and thank you very much for your kind attention.
Dr. Now we'll start taking questions.
So we'll take a few questions, Dr. Mohit, for you now. We are opening up to the participants.
Sure.
Participants, you can start writing your questions in the questions block. The first question is from Sachin Sahani. The question is, what are the types of containments used in Shakipur for given green color? What about the water table there?
Water table is a very big issue, definitely, but water table was not a problem in the Shakipur municipality. The water table locates around 50 to 60 feet deep from the mean sea level, so it was not so difficult. But definitely, if it is a big issue in other places where water table is very high. So, yeah, I mean, that's the point. The other question is, can you repeat?
Sir, what about the water table there?
Yeah, water table has mentioned.
Okay. So the question is, what are the types of containments used in Shakipur?
Okay. Containment, we have two types of containment. One is the pit toilet and the other one is the septic tank. So pit toilet, number of pit toilets is more than 5,000, around 6,000 actually in reality. And the septic tanks is more than 500. Yeah, these two types of containment, we have it in Shakipur municipality.
Are there any more questions? Okay, so thank you very much, Mohit. I think we don't have any other question, but we will move on to the next speaker, Dr. Manoj Roy from Lancaster University.
Okay, thank you very much, everyone.
Sorry, okay, yeah. Manoj, can we... he said that he sent a new presentation.
Check your email. I have already downloaded this link. Recent one.
Give us 1 minute, we are opening up presentation.
Then we'll not be able to show the slides.
He can do it himself.
He's doing from iPad,
But he says he can do it.
because he's
Manoj, can you start now, please? Now we have Manoj Roy from Lancaster University presenting.
Dr. Manoj Roy, can I please request you to unmute yourself?
Message.
Yeah.
Yeah, Manoj, you can unmute. Can you start now?
I have done it.
Yeah, now you can start.
Show your screen.
Show your screen, please.
Okay, how do I do that?
You're showing yours.
It's done.
It's done now.
It's done? Okay.
So please go ahead. 10-12 minutes. Yeah.
Okay. Thank you very much. So just a quick introduction. I am quite familiar with colleagues in CSE as well as in Bangladesh, Dr. Muid. I am actually from Bangladesh and currently working as a lecturer in Lancaster Environment Center, Lancaster University, UK. So let me just take you through, probably best is described as where we come from. And in this journey, Suresh and CSC has been really, part of the whole journey. I must admit that I am not going to be really presenting polished SFD applied, but I am coming from a very research orientated viewpoint, in which we're actually asking a quite a sort of a deeper question and try to see whether SFD can help us understand that phenomena. And our focus is low-income urban settlements in developing world, and probably this is where most of us and those who are attending work and as well as come from or live. So I would probably take you to a journey. All of you actually know the problem is, but still give me an opportunity to actually explain the problem. And then probably it will make sense for you then to understand the title, The Last 100 Meters, Safeguarding Potable Water Provisioning to Urban Informal Settlement. Just to acknowledge that this is a research idea that has been with us for a while. On your right screen, you can see that the last 100 meter was actually a project funded by British Academy under the UK's Global Challenge Research Fund. And while, and just to acknowledge that this is where WaterAid, where Muid is from, as well as CSC, is a partner. And just while this project is ongoing, then also we got a much bigger project that's going into Africa wide, that is called Recirculate. So what is this actually last 100 phenomena, last 100 meters phenomena? So we have produced a short film, which you can click here and see later on, because at the moment I have got a little bit of time. So I am actually skipping this film. So you may be able to see it in your own time, but do let us know if you want further information on this. So let us just try to define what we actually mean by last 100 meters. On your left, you can see a photograph, which is quite common probably in many low-income settlements, is that municipal water provisioning, shown in the blue arrow, is probably many duty bearers, municipality, even donors are actually bringing increasingly to low-income communities. But usually this water does not enter into people's home. Rather, they are placed as a common place where actually the people who reside around that water supply point come and collect. In this picture taken from Dar es Salaam, Tanzania, a lady has come with a bucket to collect a bucket of water. And you can see the red dots that are actually showing her house. It's not very far, maybe, in this case it's 20-30 meters. So, and then you can see just outside her home, the toilet. And you can see that, toilet is not connected to the sewerage system. It has effluent really going into the courtyard. So one could very easily understand what will happen with this water that she actually collected from that water point. And by the time she actually drinks, and there are a lot of things happening in this open space where effluent is coming. So the basic hypothesis that we are coming is that municipality and increasingly donors and others are actually trying to do a good work by bringing better quality water to low-income people. That is to say that we are hypothesizing that by the time the water is actually coming out of this tap, it is reasonably good quality. But by the time the lady is actually consuming that water in her home, that water will be contaminated by fecal material that is just spread around her home, around the toilet. So this space, this little short distance from the collection of this, assumed better quality of water from the water point, usually known as standpipes, to the home where people are actually consuming, is what we are meaning as the last 100 meters of potable water journey. So just to schematically present, we all know that there is in the city-wide, either from groundwater or surface water, we have got a main water pump. So main water line comes distributed to low-income settlements, and this is where our area of concern is presented in a dotted rectangle. And you can see that water main is entering into these settlements, and the picture shown here is actually a situation in Bangladesh, where you can see, because the water was not always pressurized, so people have been quite creative. They actually developed an underground storage system and then installed hand pump on it to actually supply water all the day. So the lady is coming and collecting water and taking home. So you can see that the Tanzanian case shown in the previous picture and the Bangladesh case is probably not very different. It is actually once again proving this idea is that probably the water that is treated and supplied through the municipal water pipe is coming to low-income settlements reasonably good, safe. But by the time people actually manually carry and consume in their home, that water gets contaminated. So that's what we are actually proposing here is actually three hypotheses. One is that we are saying that by expanding the water safety practices beyond the household domain, we can actually improve modestly the safety of water. So at the heart of this hypothesis is saying that there are two types of safety plan being promoted: this water safety plan and sanitation safety plan. So this one first hypothesis actually is talking that the increasingly our intention to provide only water to the low-income settlements is not going to be producing very sustainable solution that we wanted to show here. And the second is that municipal water provisioning is usually, do not associate with fecal containment, sort of taken together with the water provisioning. So that's why we are kind of framing the second hypothesis as saying that, okay, if we do nothing with the water, safety plan in these communities, but really do very well in terms of fecal contamination, preventing the fecal contamination, we'll probably do better. And the third is that by combining these two, water safety plan and sanitation safety plan, we'll gain probably better than individual hypothesis, individual action as one or two. But I think we are putting us in the firing line by saying that if you are resource constrained, the added gain on hypothesis 2, that means implementing sanitation safety plan in the combined effort may not be that significant. So in other words, saying that if we have limited budget, probably sanitation safety plan is our best option to minimize localized contamination of the water provision that actually arrive in this low-income settlement reasonably safe. Now, we actually went to design an experimental study to actually prove this hypothesis. Okay, this is where last 100 meters design actually come into. So we are actually identifying 4 distinct platforms to do this. One is that experimental design. Second is this actually characterization will involve social survey, that will involve mapping, surveys, interviews, structured observation, a lot of different things. And then the second strand is, third strand is the action research, where we actually deliberately pay for water safety plan and sanitation safety plan, and we do a process documentation. Finally, we also Vitus, can you see my screen?
Yeah, we can hear you. Go on.
Okay, but why that I got a message saying that. Okay, so sorry, final one is the environmental observation. So you can see that then we selected 4 low-income settlements in two cities. One is Dhaka, Bangladesh. Another one is Dar es Salaam, Tanzania. So one of our settlement is control. Second one is only going to be intervention 1, that is water safety plan. Third is where we are doing only sanitation safety plan, and the fourth is actually combining both sanitation and water safety plan. So you can see that site 1 is control, site 2 is WSP, site 3 is SSP, and site 4 is combined, and that is happening in 2 cities. So the whole experiment is about 12 months, excuse me. And as you can see, social survey will be doing a baseline, then detecting changes to the baseline and the post-intervention. And environmental observation, again, will be pre-intervention, during intervention, and post. And the important bit for this discussion is the sanitation action research, is the system assessment, and that the intervention and post-intervention. And you can see that where we are actually positioning the SFD in here is actually we are doing a pre-intervention SFDs and a post-intervention SFDs, as if to see that the intervention we are going to see whether it actually producing any detectable change in SFD estimation for these sites, and also whether the post-intervention improvement that might be able to see is actually really also linked to the environmental improvement. So we actually went into to ground our design and actually called into some of these activities ongoing. So I'm just taking through some of these pictures. We are using a term called Bosti, which is the Bengali name of low-income settlement in Bangladesh, Bosti K, to just hide the identity of the settlements we are presenting. Just to say, this is the picture of Bosti K in 2005. As you can see, red dots are shallow dug well, and all these little brownish dots are the hanging latrines. So you can see that there are 2 water bodies, and life in Bosti K was very bad in 2005. Okay. Now something changed in Bangladesh. We was also mentioning that Bangladesh has this these possibilities of really getting civil society advocacy and influencing policy. So in 2007, we had quite a sort of massive change in the policy. Before that, government did not really allow the water and these sort of utilities to come to low-income settlements. But in 2007, they said that if civil society organizations can actually mobilize low-income people and act as an intermediary, then water and sanitation can be brought to these settlements. So suddenly you see that by 2009, all these hanging latrines almost disappeared, and the shallow dug well also disappeared, and that is replaced by those hand pumps on the water reservoir and the public toilets, community toilets. And by 2015, this has actually much improved. So one could probably assume that life has gone better in this settlement. But our study is showing that that probably is not the case. As you can remember, this is a reflection of that schematic I was showing before, this main pump, the hand pump on feeder road, and the lady taking home. As you can see that we have actually tested the fecal coliform count along the journey. As you can see that this has substantially increased within the settlement. So the basic hypothesis is that the water is actually arriving to these settlements relatively safe, but then get contaminated because of the localized release of fecal material. So Bosti K is a site of one of our last 100-meter both intervention, and a lot is being done. This is a pictures of, this is sort of mapping, saying that we have actually mapped the toilets, mapped the water point, and actually found those households who are actually using each of these facilities. This color scheme is showing you. And these are just pictures of environmental characterization, environmental monitoring, just to say that we have actually tested water quality along the water journey, starting from water main to the water storage, to the hand pump, to people's vessels, as well as from the drinking glass. And that we did pre, during, and post intervention. Okay, now some of these interventions I was mentioning, that we have fixed, mended toilets, water points, and emptied those chambers. Just to mention that we are actually not building any new water points nor any new toilets. We are actually working with the existing facilities and making them leak proof and emptying them. And then we also had promoted behavioral change. This is where a localized street drama being played. There are a lot of other activities. This is an example of adolescents, girls who were trained to convey the behavioral message to these their moms and aunties just around the toilets, around the water point, just to say that what they should not do and what they should do. Particularly in this case, they were using real pictures of open defecation, not by adult people, but by kids, and how do you actually deal with these things. So this has been a major things, and I was able to also to present these basic common sense research idea to the UK's parliament. So that's where I would like to be stopped, that we hope to be able to share our results about the SFDs and linked with our outcome in terms of whether we have been able to reduce the water contamination in the last 100 meters by early next year. So thank you very much.
Thank you, Manoj. Thank you, Manoj. And now we will open up the floor for quick questions.
Okay, how do I get to the...
We will read out the questions. They'll come on screen, Manoj.
Okay.
Are there any questions, participants? If you can write it or raise your hand. Okay. So, Manoj, I think there are no questions. Thank you very much. So we'll move on to the third speaker. And now we have Unnati Jack from South Africa, Imanti Consulting. There is a nationwide campaign on, developing SFDs in South Africa. Unnati, so can you take 10 minutes and quickly run us through it? No, we can't hear.
Oh, okay. Okay. Good day, everyone. I'm going to talk about what we have done in South Africa so far. So we can go to the presentation.
Share the screen.
Unnati, can you please share your screen?
Okay. Yes.
Yes, we can see.
We can see your screen,
Okay.
and we see you.
Okay.
Yeah.
No, this is not screen.
Are you okay now, Amrita?
We still cannot see your
Presentation.
Unnati.
You're right.
You cannot see?
No, please click on your dashboard on sharing
Okay.
and click on show. Under that, you need to click on your presentation.
Oh, okay. Can you see me now?
Yes.
Yes.
Go ahead, please.
Okay. Okay. Then are you putting my presentation up then? Or should I?
She's taking the lead. Ask her to open the presentation on her screen.
Unnati, please open the presentation on your own screen.
Okay.
Yeah. Please start the presentation. Thank you.
Okay. Okay, what I'm going to, the content of my presentation, I'm going to talk under the topics that you can see there. The project, the way it came about, Emanti Management, which is my company, was appointed by the Water Research Commission of South Africa to develop SFDs for selected municipalities in the country, that is in South Africa. About 30 SFDs are targeted to be developed in different provinces of the country. This project came about because the Water Research Commission noted the challenges that are faced in the country, the sanitation-related challenges. These came through the Statistics South Africa report, what has been reported on the news, including school sanitation challenges. Just to give an example of that, we had incidents of school learners falling in the pit latrines at schools, such that our president has requested the status of a report about the status of sanitation at schools. There's also a lot that has been done in terms of building infrastructure. There were programs that have been developed to build infrastructure, that is building toilets for the communities. However, what was noted was that many municipalities did not put budget for O&M, and there was lack in terms of policies and management procedures that would support those programs. There's also challenges that have been noted of sludge management in the country that came strongly through the green drop audits. Green drop audits, actually the green drop program is an incentive-based regulation program that has been developed by our regulator at the Department of Water and Sanitation to audit the status of wastewater systems in our country at the municipalities. It was also noted that though the green drop audit was supposed to look at wastewater and sanitation matters, it focused more on wastewater treatment systems with less focus on sanitation systems. Therefore, this project is aiming to improve the situation by developing SFDs for those targeted municipalities. I think I should mention, though, that we are at the early stages of the project. The project started in April this year. Therefore, we don't have concrete results as to how did we apply our SFD. However, I will present what we have done and what was our approach and what we are hoping to achieve through the project. In order to improve this situation that I have noted above, there is a program that exists, Blue Drop, which is looking at auditing drinking water systems in the country. And I have mentioned that Green Drop is looking at auditing wastewater systems. There is a No Drop that is looking at auditing water conservation related issues. However, there is a gap when it comes to sanitation related issues. There's no audit or assessments done. Therefore, we see that there could be a drop coming out of the project. Probably it could be named a brown drop. Around 30% of South Africa relies on on-site sanitation. We are hoping that the development of SFDs would assist the sector and the country understand the state of their sanitation infrastructure, but not only understand the state of the infrastructure, but also understand the management of the whole sanitation value chain. Then the approach that the team has taken in order to achieve what the project is aiming, we have introduced the project to water, wastewater and sanitation sector through what we call master classes. And when I talk about the sector, that includes municipalities who are responsible for sanitation provision, the regulatory body, which is the Department of Water and Sanitation, and other supporting departments. So all these sector partners were invited at the master classes. The master classes were held at 2 regions out of the 3. We are targeting 3 regions. However, at this stage, we have conducted 2 master classes. At the master classes, the sector was, the benefits of developing SFDs were presented. And CSE was part of this exercise. They assisted the team in sensitizing the sector at the master classes. After that, data for targeted or selected municipalities was collected through their institutional public documents. We conducted interviews with the municipalities. We conducted site visits where applicable. And the municipalities were allowed to decide on the SFD boundary. What I mean by that is the municipality would decide if they want to develop SFD for the whole district, which is a combination of local municipalities within that municipality, or if they want to develop SFD for a local municipality, which includes smaller towns in the municipality, or they decide to develop SFD for a particular town that is a particular system within their area. 3 face-to-face municipal engagements have been conducted so far. However, the 3rd one is incomplete. We still need to collect more data on that one. 2 of these municipalities decided to develop SFD on one system, which means one town in their area, within their area. And the 3rd municipality decided to develop SFD for the entire municipal area. And then the information that was collected, it was fed to the Susana website. So we used the graphic generator on the Susana website to generate the SFD graphic. As you understand that SFD can be developed at 3 levels. Where we are developing level 1, that is the initial level, we are going to develop an SFD light report, and in cases where we are developing where we had intermediate, we are targeting intermediate level, then we will develop the report that is the standard format template that is used on the Susana website. The challenges that we experienced through our exercises and interactions. The first thing was the terminology in naming the sanitation technologies. We found that the terminology that was used at different municipalities was different. Actually, the terminology used at municipalities did not fit what SFD explanation named the technologies. For an example, we go to a municipality and they would say they've got septic tanks. And if we go out on site, or if we investigate further as to understand what they mean by septic tank, then we would discover that it's just a tank without an outlet. Therefore, that's one thing we had to clarify is to come to a common understanding of naming the technologies. The information collection was actually a challenge, because information had to be collected from different departments. Within the same municipality, information would be sourced from different departments, and also you'd find that some information has to be sourced from external departments outside the municipality. Then the other thing was the sources of data. We found that some sources, we get conflicting data from different sources. Sorry. What we would find maybe from a secondary data that is from the reports may be conflicting to what the primary data, when we sit with these people and discuss the data, then you find that then it's conflicting, then which made it difficult for us to decide which data to use. And the other thing was that the selection of boundary, we found that it's not always clear when you are starting to develop an SFD as to what boundary to use, because sometimes the municipality would decide, okay, we are going to develop an SFD for the entire municipality, only to find out that there is insufficient data to develop for the entire municipality, but then they decide they rather have data for a specific town. So that was another challenge we ran into. The interviews with some of the stakeholders became a challenge, especially in cases where the tanker provision or the tanker services are not are outsourced. Therefore, it's not the responsibility of the municipality. So we could not interview those people. The other thing is record keeping. In terms of understanding what is going on at the treatment plant, or what is going on from the point of collection, an example is that there's no records as to how much is sludge is taken to the wastewater treatment plant, how many tankers are going and discharging, where are they collecting, where are they discharging. So those are some of the challenges that we experienced. Though there are challenges, there are positives we also noted. CSE support to a multi-team fast-tracked SFD development. The municipalities expressed a need and understanding or the benefit of developing SFDs. And from the master classes, the sector supports the initiative at local and also at the national level. The master classes were linked to an existing municipal benchmarking initiative, which is well known in our country, where municipalities get to learn from each other, information sharing and learning. Therefore, linking this to that was a positive for us. And we are hoping that once we have this information from SFDs, we will be able to present the sanitation status of the country, though this will be a representative of the status of the country, which will contribute to SDG reporting requirements and other national and international reporting. Just to mention a few examples of how the municipalities indicated that they would use their SFDs for. Jogabi has more than 10 systems. We assisted with only one SFD development. They indicated that they would like to develop SFDs for more additional systems. And they indicated that they would use the report to convey their status to financial and non-technical departments, which should motivate prioritization of funding and specific actions to areas of most need in the municipality. The Buffalo City municipalities indicated that they are most interested in finding in economic viable reuse of sludge, whilst the Umgungundlovu district municipality, they indicated that they see this influencing their sanitation related policy amendments. And all of these municipalities, this one is a common challenge to all. They indicated that they realized that they have limited control and monitoring of service providers, especially when it comes to tanker operators. Now they will be able to find means as to how do they draw up their contracts and service level agreements. And also they think this would assist in monitoring their toilet construction. That means they would look at what are the appropriate construction methodologies that have to be used when constructing these sanitation systems. The next steps that we are going to follow, we are at a stage where we are busy drafting the SFD reports for the municipalities that have participated. Then we are going to send those draft reports to municipalities for comments. Then from the inputs that we're going to receive, then we finalize the report. After that, we send those reports to CSE for review, and then the SFDs would be finalized, and then they can apply their findings. Then we are going to develop more SFDs. As I indicated, we're targeting about 30. Then we're going to analyze the data and develop a status report, which should help guide way forward and hopefully lead towards the brown drop. Thank you.
Unnati, so we have, thank you so much for your presentation. We have some questions for you. Okay.
Okay.
The first question is, the name is not being portrayed over here. So the question is, as the process on SFD has recently started, how much time do you think will it take to provide an initial concrete result?
How much time do we think we need to complete the task, or all 30?
To provide an initial concrete result, a definite result.
Completion.
Amrita?
When do you complete the project, this entire process?
Oh, okay. The project is it is a 3-year project. As I indicated, this is only the first year. So though it's a 3-year project, we are hoping to have developed all 30 SFDs by next year. Then yes.
The next question is from Navmani, and the question is, how is conflicting data addressed? Have you conducted primary survey and decided?
Okay. Through discussions with municipalities and looking at that secondary data, we had to look at what is the most reliable data, and the municipality would assist us decide which data to choose. So we would look at what's the most reliable and what is the granularity of that data. So that's how we would address the.
Could you please repeat the information that you gave on the primary survey?
Okay, I'm saying we would decide on how to use, what to use, which data to use, and we would consider what data is most reliable. So we would look at the reliability of the data, which means we look at the source, we look at the age of the data. So if it's data from 2010, and then we are presented with more recent data, so we would take that into consideration. So it's reliability, it's the age of data, so we would look at things like that.
And another question is, how were the improperly built septic tanks addressed in the SFD?
Okay, we had to use the definitions on SFD. Therefore, we had to explain to municipalities how are these technologies defined according to SFD. So whether what they call a septic tank versus what SFD defines septic tank, we had to have discussions and explain that and actually come to an understanding as to this is how SFD defines this technology.
All right. If any other attendee has questions for Unnati, please ask the question now, or we can move on to the next speaker. Thank you, Unnati. I think that's about it as the questions we've had. Thank you for the presentation. Thank you. For the next. Now we have Dr. Zachary Burt from Columbia University.
Go ahead.
Hello. I think we're. Oh, hello. Can everyone hear me?
Yes, we can hear you, Zach.
Okay, great. So I think we're running up against the end of the time here, so I'll just go as quickly as possible. Sorry, just a second. So this SFD is being developed right now. We're collecting data as we speak in Hubli Dharwad, which is in northern Karnataka in southern India. We're doing a regular SFD, but we're also trying to do a variation of the SFD, which incorporates equity. So we're doing we're trying to develop a modified SFD in order to look at equity as well. This is a collaboration among GIZ, UC Berkeley, myself from Columbia, IIT Bombay, as well as Azim Premji University, and then the Center for Multidisciplinary Development Research, which is our local collaborators in Hubli Dharwad. Just very briefly, I want to introduce this idea of a difference between equality and equity. In the sanitation space, I would define equality as some sort of minimum level of access that everyone is guaranteed, yet equity is more nuanced than that. That's looking at all of the different costs and benefits, both direct and indirect, at the individual and household level, and accounting for those differences throughout the population. This third category of justice, I think, is a little bit more difficult in the in sanitation systems, only because infrastructure is required that has costs associated with it, and so a price is always going to be there. So there's always going to be some kind of barrier. But I think if we can understand the difference between equity and equality, that would be an important improvement in our understanding of sanitation systems. Now, I also want to make a distinction between access and exposure. So the MDGs first, and then also as a continuation of that, the SDGs have a lot of focus on access. The SDGs were an improvement in two ways. One is that equity started to be introduced as a concept that could be tracked in the SDGs. And then in addition, this idea of safely managed sanitation. So this is the first time that this idea was introduced in order to look beyond just the toilet or latrine, so looking beyond just the user interface. The issue that I personally have with this approach of adding another rung onto the sanitation ladder is that it treats safe management as just another type of access, which I think is a little bit like putting a square peg in a round hole. I think that by doing that, you ignore the importance of exposure and the importance of trying to limit exposure in the system. And I'm going to argue in the rest of this presentation that looking at exposure is an important part of looking at equity as well. But just briefly emphasize that inequity in sanitation systems is also expressed through access in addition to exposure. And that's something that's already tracked quite a bit, that I think people are more familiar with. You know, there's this discrepancy between access in urban areas and rural areas, as well as there's inequity between large and small cities, just as examples. But what we're trying to do is also look at equity in terms of exposure. So not just looking at who has access to what, but also how much wastewater and septage is not treated, and then where does it go? It goes into the environment, but the environment is not just this faceless, nameless entity. The environment oftentimes is other residents of the same city or other cities. And so when that happens, then that becomes an issue for inequity. Specific sources of inequity, or specific points of exposure that we have identified that we are now trying to track and quantify in terms of the types of people and the number of people that are exposed in these ways include groundwater contamination, piped water contamination, direct contact with open drains, flooding, lack of protections for sanitation workers, as well as for farm workers that are engaged in reuse. The goal of this project is to highlight social inequities, economic externalities, and issues of environmental justice in sanitation system upgrades. And we're doing that through creating a modified SFD. This is just an example. It's not based on actual data. We're still in the process of collecting data, as I've said. But this is to give you an idea of visually what we are thinking that we will eventually try to do. So if you look on the left-hand side of the SFD, you can see that we've added these stacked bars. Each color represents a different wealth quartile. And so the assumption here being that for the access type of connecting to a sewer system, there's going to be a disproportionate number of households in the highest wealth quartile, whereas the reverse is true for on-site sanitation, which has a disproportionate number in the lowest wealth quartile. Similarly, we would like to break down different points of disposal, different points of exposure, and then show how that, again, breaks down among these wealth quartiles, for example. So in this case, exposure is assumed to be higher among the poorest wealth quartile. In addition, in our data collection, we're also looking at gender inequities in the sanitation system, which we found largely to be outside of the home. So we're tracking access in the workplace and schools as well as when traveling. And we're also collecting data on sanitation workers and whether or not they have proper training and protective gear. The goal of this project is to try to track inequities in the sanitation system. So I thought that I would give you some concrete examples through photographs to give you some qualitative idea, just a few, of what we're trying to quantify. So when we talk about septage disposal, a lot of septage disposals now done illegally and without proper treatment or protective gear. And so inequities arise both for the sanitation workers in this case or for the local residents in the locations where disposal happens. Likewise, when septage is reused instead of disposed, but it's not treated properly and the farm workers are not given proper protective gear, then this can expose them to health risks as well as contaminate agricultural products, introducing, and in this way introduce inequities in the system. In this example, we can see these, hopefully people can see these pipes which are hanging suspended over this drainage canal. The drainage canal is also filled with solid waste. And as you can imagine, during the monsoon season, more solid waste comes, more water also comes, and the drain fills to the point where it puts these drinking water pipes at risk of contamination. This is an example that's happening above ground, which is fairly rare, but the exact same mechanism actually happens below ground quite often. And so this is another point at which sanitation inequities can be introduced into the system through piped water contamination or similarly through groundwater contamination. So this photo and the next are the last two in the series. This photo shows a housewife in Hubli Dharwad pointing to the level at which flooding occurs in her home during the monsoon. And this is a picture of her home on the outside. And what I want you to notice in this picture, you can see the drain in front of her house, loosely covered by these stone slats. But but also I hope people can see inside of this red circle both the cement block that she's put across her threshold in order to hold back the flood water, which, since she's already pointed out, is not effective during the worst or most heaviest rains. I also want you to notice here, this is her drinking water access point, this pipe there, this white pipe. And I want you to notice the level at which that pipe rests. Now, the last thing I want you to notice is this apartment building right next door and the drain off in the corner, the drain in front of that apartment building. And you can see the top of that drain, that's the maximum flood level. If you draw a line across the picture, that maximum flood level of that drain, that maximum level before any flooding happenings, any flooding happens for the apartment building, is the same level roughly that she pointed to in her house. So this is an example where investments were made to improve the drains, the drainage network in front of the apartment building, and that benefited those people. But then it seems fairly likely that that investment had negative repercussions on their neighbors. And so in this way, inequity was introduced in the system that wasn't previously accounted for. So if anyone has any questions, this is also my contact information. Thank you for listening.
Thank you, Jakari, for a nice presentation. Now we open up for questions.
So exactly the first question that we have is, does it conclude that using centralized system is better than decentralized systems?
I don't think that our research would conclusively show that. I think that what we're trying to show is the points of exposure in both types of systems. And so I think that there is some danger of contamination for decentralized, for on-site systems with fecal sludge management if you don't have proper septic tanks, if you don't have proper transport, you don't have proper treatment. But this same analogy could be made for centralized systems as well. So for centralized systems, if you have contamination in the sewer network, if you don't have proper treatment before disposal, then you have the exact same types of risks of exposure in the system. So I think both have their risks, and both need to indicate where exposure is happening.
The next question is by Dr. Manoj Roy. Are you capturing seasonal variations in your study?
So we are trying to capture flooding, and flooding is something that happens seasonally. So we're not capturing monthly data or anything with that resolution, but certainly that is one of the things that we're trying to get at, is comparison between rainy season versus the rest of the year.
The next question is, to avoid contamination, government usually covers the drains. What is your opinion?
I think actually covering the drain, having some sort of underground system does eliminate the exposure pathway of having direct contact, which I think is important. There's still maybe some risk of exposure through contamination in drinking water pipes as well. So that certainly is an improvement, but it does not eliminate all risks.
If we have any more questions for the remaining presenters, please feel free to ask your questions. So I'll start with the questions which couldn't have been answered earlier. Okay, So Dr. Moeen has left. So I'll start with the questions for Dr. Roy. The first question for Dr. Roy is, has the SFD been done? Dr. Roy, can you hear me? Dr. Roy, yourself muted. Could you please unmute yourself?
Okay, can you hear?
Yes, sir.
Yes, we have done the pre-intervention SFDs. At the moment, our post-intervention SFDs are ongoing. So we wanted to find those pre and post and compare and then sort of disclose our findings.
Okay, next is, can we use bioremediation for wastewater management? This is for Dr. Roy.
Yeah, can you repeat the question, please?
Can't we use bioremediation for wastewater management?
Okay, I mean, those who are familiar with the low-income settlements and they appreciate that these are very, very highly densely populated settlements, and you know, even constructing toilet is difficult in these settlements, and bioremediation would require space and time. I don't think that seems to be feasible in this situation. There are certain effort going on. I understand that some of these not so densely populated and not so informal settlement is some sort of a kind of a decentralized, they call it DWATs kind of things, where they are actually constructing a much bigger septic tank, and where the toilets possible to be connected could be connected, but these are very far and few. So the typical settlements that we are working, bioremediation seems to be impossible.
Zach, can you hear us?
Sakari, can you hear us?
Sorry, yes, I can hear you. Sorry, I was muted for a second.
So there's the question for you, and the question is from Love Money. The question is that health information captured during survey? Do you have information on groundwater pollution and health impact? Do you want me to?
For this, no, I heard. So for this survey, we have decided to not collect health information. I do think that health information would be valuable, but the goal of this survey was to try to create a protocol which others could use to make a modified SFD. And so we wanted a visual tool, a visual diagram that was easy to make. And although health data I think would be valuable, it would be much more resource intensive and much more difficult in terms of analysis. So I would encourage other people, and I hope that in the future I'm able to collect that kind of data, but right now we're not.
So we do not have any more questions for now.
But I think it was very good discussion, and we could bring together several experiences or experiments going on how to use SFDs in different contexts, starting from a national level and a state level and city level to now talking about its slum areas, the pockets where actual interventions are happening, pre and post, and addressing different variety of issues like equity issues being addressed at the end by the Caribbean in India. So I think there is, I could see today that, variations of use of SFD, and I think a lot of experiments yet to come. So in the previous first webinar, we have told you that, we have come across almost 1,500 plus SFDs which have been created till date now. it's kind of I would say part you can say we are getting to see the success of the SFD as an advocacy tool, and people are also innovating and they are also creating their own SFDs with different methodologies. I'm sure there is much more to come. You will stay tuned with us for the third seminar in series in the near future. So thank you very much to all the speakers and the participants. We had 44 people registered for the